Well, one reason that I'm not an essentialist as opposed to, some kind of biopsychosocial type is that, over many years we were following the young children, and we published one follow-up study in 2008 on a small sample of birth-assigned females. We finally got around to publishing our follow-up study of birth-assigned males in 2021, where, like many of the other, well, almost all of the other follow-up studies in the literature, we found a high rate of desistance, 88% in our two studies. And because, I knew that this was what we were finding, maybe that reinforced my perspective that when seeing young kids, it's too early to know how things are going to evolve. And as we talked about in our 2021 paper, if you look at the dozen or so follow-up studies in the literature, the kinds of treatment kids had in these studies, if they did have treatment, was varied. It could have been parents doing things in the day-to-day environment, like arranging play dates. It could have been parent counseling, could have been individual therapy for the kid, of various types. There were the psychodynamic, psychoanalytic approaches, behavior therapy approaches, a whole wide range of therapeutic approaches, basically based on the philosophical and theoretical biases of the clinician that parents happen to see. But in these older follow-up studies, virtually none of the kids had as a form of psychosocial treatment a gender social transition. Now, as I was saying earlier, an unknown percentage of prepubertal kids are socially transitioned. Their parents might implement that even before seeing a clinician. A clinician might recommend it. Maybe the clinician and parent do it together, et cetera, et cetera. And I've written a few papers where, I've said, I don't think that these older follow-up studies can necessarily be used to predict what's going to happen to, in the long run, kids who socially transition. That I think